Hello and welcome to True Pathfinder, your portal to health and truth. And in this video, we're going to take a close look at another very common microparasitic infection that can also be regularly found in Lyme disease patients, namely Babesia. What is Babesia? What are the symptoms? How can we test for it? What are the life cycles of this microparasite? What does it do to your body? And most importantly, how can we treat this microparasitic infection successfully in a natural way? Well, let's find out. What is Babesia then? Well, it is a microparasite that spreads primarily through ticks, and so perhaps unsurprisingly, it is a very common co-infection in people with chronic Lyme disease. It may be present in up to 40% of Lyme patients according to a report in Trends in Parasitology. There is not just one single Babesia strain you must worry about. A tick can carry multiple species and strains of Babesia, and there are more than 100 different species of Babesia in all, though only about a dozen are known to cause human illness. The most common Babesia species known to cause human illness are Babesia microti, Babesia divergens, and Babesia duncani. Babesia species are more like groups of very similar organisms than distinct species. Babesia has a near infinite ability to continually change its genotype, meaning it can easily alter its physical form and function to adapt to disruptions in its environment, such as antibiotics. Babesia is actually a distant cousin of malaria. It is a protozoan. That means that it is a one-celled organism with a nucleus that surrounds its DNA. Protozoans have a nucleus like other high-level organisms, opposed to bacteria which have no true nucleus. Otherwise, it is more bacteria-like and even responds to some antibacterial agents. But because it's a parasite, it must have a host to survive. Like malaria, Babesia primarily infects red blood cells. It can infect anything with red blood cells, meaning mammals, birds, reptiles, amphibians, etc. And from the days of the dinosaurs to our modern day, Babesia has been infecting animals for hundreds of millions of years. The modern reservoir for Babesia, one of the primary ones, is the white-footed mouse. It does not cause disease in the mouse or in the tick that transmits it, however. Infections with Babesia occur most commonly in New England, New York, New Jersey, Wisconsin, and Minnesota, but it is also becoming very common in the southeast. Georgia is the epicenter of the southern US infections, and it is most spread there by black-legged deer ticks, primarily during the nymph stage. Nymph ticks are only about the size of a sesame seed and very hard to see, and because tick saliva reduces the sensation and allergic reaction to the tick bite, it can take days before you notice that you've been bitten by the tick, or you might not notice it ever. Once inside of the human host, the Babesia itself often goes unnoticed too. It is a stealth microbe with similar low virulence characteristics to other stealth microbes. Some characteristics of an infection with Babesia are that the initial infection is often mild or does not cause any symptoms at all in a lot of people. The chronic infection is associated with a chronic immune dysfunction. Low-grade chronic illness is associated with vague and non-specific symptoms. The microbe is typically present in low concentrations in the body. It has a slow growth rate. It lives and reproduces inside of the red blood cells, so it lives intracellularly. It is tough to diagnose. It responds poorly to antibiotics and vaccines. It can alter its genotype at will for any environmental change and can become highly virulent in certain situations and cause severe acute illnesses and even death. Therefore, severe acute Babesia infections should be managed appropriately and aggressively, usually with one or more medications. Because of its potential to cause severe disease, Babesia is higher on the virulence scale than other Lyme co-infections, and initially Babesia was thought to be less prevalent than other co-infections like Bartonella and Mycoplasma that we have also discussed on this channel. I'm gonna link the videos down below for you. The results, however, of a 2014 patient survey showed that out of more than 3,000 participants, 32 of the respondents had been diagnosed with Babesia, which places it only second to Borrelia. One thing is for sure, Babesia, like all tick-borne infections, is on the rise, and knowing its signs and symptoms is crucial for getting an accurate diagnosis and proper treatment. The symptoms of mild and severe Babesia infection are that the people that are bitten by a tick-carrying Babesia may hardly get sick or suddenly get very sick. For individuals also, it's important to know that have a healthy immune system, the Babesia infections are typically associated with few symptoms that feel like a mild bout of the flu that lasts 1 to 2 weeks. After a mild initial infection, the person can become an asymptomatic carrier, and asymptomatic carriers can become severely ill if the immune status falters later. How can we diagnose Babesia infections then? Well, before we answer this question, short reminder, if you enjoy our content, please support us directly by becoming a patron from as little as $5 per month. Link is in the description box below for you. Also, do not forget to like, share, subscribe if you're not already, and comment to help this channel grow and spread the truth. For the holistic treatments you need and deserve, and yes, we have a lot of experience with Babesia infections as well as Bartonella, Mycoplasma, all the Lyme co-infections. Please contact us at christine.doctor. We will take care of you holistically and naturally, and remotely of course. And also check out some of the most powerful holistic health tools available on the market today at vibrantbody.net. Links are, as always, also in the description box below for you. Alright then, how can we diagnose Babesia? When a relapsing high fever occurs with anemia, jaundice and spleen enlargement, Babesia should be considered as one of the causes. And we have different methods that we can use to check whether the Babesia is the cause. One of them is direct visualization. The red blood cells in this procedure are stained with a special stain called GEMSA and are then viewed under a microscope. Babesia organisms have the appearance of a Maltese cross or double pair sign inside of the affected red blood cells. Like other stealth microbes, however, Babesia often remains elusive because the concentrations of the organism are low in the body. Only about 1% of the red blood cells are typically affected, and it's also very hard to see inside of the stained cells. Even the best lab technicians have a very hard time picking Babesia up. About the only time direct visualization is valuable is during acute infection with high fever. In a 2015 article in the Townsend Letter, James Schaller, MD, and MAR, so a specialist in the treatment of Lyme disease and Babesia, stated that all direct testing for Babesia is 95% inaccurate. We can also try a PCR test to detect the microbial DNA in the blood sample. However, this test is not sensitive enough to pick up Babesia in most cases. Then we have the IGeneX test. This test uses an amplified version of PCR for improved testing accuracy for Babesia microti and duncani. According to Dr. Schall, however, in this practice the pickup rate is also very low at only about 25%. And the primary drawback of testing with this method, IGeneX, is the high expense and lack of coverage by insurance. We at Christine.Doctor offer two unique methods: holistic health assessment that takes place remotely. We perform a DNA scan to identify the Babesia infections and hundreds of other pathogens with very high accuracy. And we have scientific evidence that Babesia is associated with microparasites. The disease, the proliferation, and the development stages occur in the same way. The first stage is intravascular, followed by the extravascular phase, then the invasion of the connective tissue, and finally the invasion and the destruction of the stem cells. And we have also a unique method for microparasite testing here at Christine.Doctor, so please do not hesitate to contact us. As mentioned, link is in the description box below. As mentioned, Babesia is often transmitted by hard ticks. After entering the bloodstream through a tick bite, the Babesia immediately invades the red blood cells, and inside of the red blood cells the organisms rapidly divide through asexual reproduction and fill the cell with the Babesia organisms. The organisms stick large numbers of red blood cells together in clusters as a food source and also to gain protection from our immune system. And this can result in the spontaneous rupture of small blood vessels, causing bruising and the formation of petechiae, so small red spots on the skin. Additionally, because red blood cells are destroyed, severe Babesia infection can mimic cancer. Enlarged red blood cells, swollen with organisms, can also impede the passage through the capillaries. Babesia therefore increases clotting, and we see this in people who are infected with Babesia. They clot very fast. In the worst case scenario, this can even cause mini strokes. The blockage of the small blood vessels from the swollen blood vessels and the increased clotting are one of the main ways that the Babesia causes harm. Via the red blood cells, the Babesia organisms circulate throughout the whole body, and eventually Babesia organisms invade the cells lining of the liver and spleen, more precisely the endothelial cells. As a result, the vacuoles, or the small cysts, are formed to gain protection from the immune system and the antibiotics. And inside the liver and the spleen, the Babesia organisms reproduce sexually. Sexual reproduction allows for maximal genetic diversity. During a complete life cycle, that you can also see, by the way, here in the picture on the right, the Babesia goes through 4 separate stages: the sporocyte stage, gametocide, ookinets, and merocytes. And therefore, all 4 steps can be present in the body simultaneously. This guarantees maximal survivability for the Babesia. And this cycle repeats every several months, with the release of a flood of microbes into circulation and a relapse of symptoms. Babesia can be present without causing any symptoms for a very long time, And then when a trigger appears, such as an infection with Borrelia or stress caused by too much travel, too much work, trauma, a surgery, or an unexpected psychogenic event, precipitates an acute attack. Like other stealth microbes, Babesia specifically affects chemical messengers of the immune system to allow itself to flourish. These chemical messengers, called cytokines, orchestrate our entire immune response, and therefore disabling or interfering with our cytokine system is a crucial strategy of the microbes during infection. Our immune system uses specific pathways to deal with different types of microbes. There are different pathways that use various cytokines. One is the Th1 pathway, which is specific for microbes that thrive inside of the cells or live intracellularly. And this is the pathway the immune system uses to deal with stealth microbes. And then we have the Th2 pathway that is designed to deal with intestinal parasites such as nematodes. Babesia and other stealth microbes try to shift the immune response away from Th1 towards Th2. The cytokine pathway for Babesia is that we have, as mentioned, this Th1 cytokines for the intracellular microbes like IFN gamma, interleukin 12, TNF alpha, and then we have the Th2 cytokines for the intestinal parasites such as interleukin 4, 5, 10, and 13. The Th1 cytokines enhance the formation of the amino acid L-arginine, which is necessary to produce nitric oxide. Nitric oxide is very toxic to microbes and is essential for killing Babesia organisms. In the initial infection stage, the Babesia immediately stimulates interleukin 10. And this has the effect of downregulating all the Th1 cytokines, reducing L-arginine, thereby and inhibiting nitrous oxide production. IFN gamma also stimulates nitrous oxide production, and decreasing nitrous oxide is one of the significant actions of the organism in the body. Interestingly enough, tick saliva also inhibits the Th1 cytokines. The longer the tick feeds, the more opportunity the microbe has to infect you. Your spleen is a vital organ for overcoming the Babesia infection. Recovery primarily depends on the spleen's production of IFN gamma and nitrous oxide. Gradually, the immune system wins out and interleukin 10 increases again. And finally, the spleen and the immune response clear the infection, but the entire cycle can repeat if all microbes have not been eradicated from your spleen and liver. The conventional medical solution focuses exclusively on killing the microbes. And while this can be effective in some cases, it does not support a restoration of normal immune function or the body's self-healing systems. And this, along with the fact that antimicrobial resistance by Babesia is becoming commonplace, dramatically limits the value of the conventional medical therapy. Here you can see the splenic immune response of mice for an acute phase of co-infection with Babesia microti and Borrelia burgdorferi. The pathogens trigger a differential immune response with more pronounced introduction of Th17 cells and Tregs in young mice and significantly higher Th2 cells in older mice. The disruption of the marginal zone and the atrophy of the B cells are also stimulated by the Babesia microti, such that fewer B cells develop into plasma cells, resulting in lower antibody production against both pathogens. The splenic macrophages are the major player in clearance of both pathogens, but because of hematopoiesis and phagocytosis of IRBCs, few of them are available for clearance of Borrelia burgdorferi, causing better survival of the spirochetes. So as you can see, those two work together and have quite well-developed survival mechanisms. Certain people are more susceptible to becoming severely ill from Babesia infection, including people who do not have a spleen anymore. They show up to 20% mortality. People with a weak immune system, be it caused by AIDS or corticosteroid therapy, malignancy with therapy, multiple stealth microbe infections at the same time, etc., etc. Older adults over 50 years old are also more at risk, especially those with chronic health problems. And as we've already touched upon, the spleen is the essential organ for overcoming Babesia. It acts like a sieve to clear organisms from your blood, and the spleen is also the source of the chemical messengers that ultimately allow the body to eradicate Babesia. What are the most common symptoms for a severe Babesia infection? High fever over 105 degrees Fahrenheit, severe fatigue and malaise, shaking, chills and sweats, severe headaches, muscle aches and muscle weakness, severe moving joints pain, gastrointestinal symptoms such as nausea, abdominal pain and diarrhea, decreased blood pressure and heartbeat, jaundice, meaning dark urine, yellow skin and eyes, easy bruising, small red spots on the skin, decreased cognition, which comes from the intravascular coagulation that we have discussed, pulmonary edemas, so your lungs fill up with water. Severe infection can last weeks and even months, and relapsing from the illness with a recurring cycle that happens every several months is also quite typical. Some signs and abnormal lab results are an enlarged spleen and liver, anemia, so low hemoglobin, decreased platelet count, evidence of hemolysis, which hints to the destruction of the red blood cells, elevated liver function, mild neutropenia or leukopenia, so a decreased count of white blood cells, low or unstable blood pressure, and organ malfunctions such as heart attacks, strokes, respiratory distress, and kidney failure. Many people who are infected with Babesia remain asymptomatic because they have a healthy immune system. However, if the immune system fails or becomes weakened due to psychosomatic stress, oxidative or acidic terrain pressure, the Babesia infection starts to cause real problems. The symptoms for those who successfully process the disease on their own mainly consist of aches and pains, low-grade fever, fatigue, and chills that sometimes accompany other flu-like symptoms. For those who need hospitalization, the symptoms panel is generally more severe. We notice especially high fevers, fatigue, chills and sweats, as well as malaise, abdominal pain, and diarrhea. That can occur actually amongst both groups. As with malaria, relapses also occur in both groups. All Babesia infections are commonly present with malaise and fatigue, followed by intermittent fever, chills, sweats, general pallor, mild hepatosplenomegaly, headaches, lightheadedness, arthralgia, myalgia, anorexia, coughing, vomiting, nausea, gastrointestinal problems, depression, and emotional lability. In those in whom the babesiosis becomes more severe, The fever may increase up to 105 degrees Fahrenheit. Shaking and chills are expected, and the liver and spleen inflammation and damage also increases in these patients. Other symptoms include non-cardiogenic pulmonary edemas and hypotension. In addition, hemolysis, so the rupture of the red blood cells, jaundice, hemoglobinuria, dark urine, proteinuria, mild neutropenia, leukopenia, atypical lymphocytosis, thrombocytopenia, retinal infarcts, anemia, ecchymosis, petechia, hyperesthesia, hepatic transminase may also become elevated, and sometimes, quite rarely, but sometimes the lymph nodes also become swollen. Neurological problems may also occur in some people due to the decrease in red blood cells in the brain and the subsequent damage to various areas of the brain caused by the blood coagulation and endothelial damage. Mental and cognitive problems as well as strokes may also occur. Severe infections and complications with acute respiratory problems, disseminated intravascular coagulation, acute kidney injuries, and eventual organ failure of the kidney, heart, liver, splenic ruptures, and septic shocks, as well as comas and even death can occur when you are severely infected. Okay, now that we've gained a better understanding of the symptoms, what a Babesia is, and all the damage it can cause you, let's look at holistic natural therapies that work. To generate reliable interventions for Babesia as well as other microparasitic infections, we must consider the dynamics of the disease. First, the cytokine dynamics. Our view about microparasitic infections such as malaria, Borrelia, and Babesia is that these pathogens must be considered in their insights of the pathogenesis as a disease. Cytokine is a small cell signaling molecule that is released by the cells that are damaged, the immune system cells and the glial cells of the brain. Most microparasites learn to use, as we have seen also with the Babesia, this cytokine for their own purposes. A cytokine cascade occurs after the immune response, and the Babesia, as we've learned, modulates the cytokine response to facilitate the breaking apart of particular cells to get the necessary nutrients and also to shut down parts of our immune system. This cytokine cascade creates most symptoms people experience when they are sick with babesiosis. Minor alterations in the cytokine cascade will cause significant shifts in the symptomatic spectrum of the disease. We also have to look at the immune system and the pre-existing conditions. The microparasites utilize inflammatory processes that occur in the body through other preconditions, for example, arthritis, and they do this in order to facilitate successful infections. Our recent experience with COVID and vaccinated patients shows that Lyme patients had a flare with other conditions such as Babesia, Ehrlichia, Anaplasma, Mycoplasma, and even MS and cancer due to these cytokine interferences and the induced mutations in the immune system. Immune system health is a crucial element in the treatment of all co-infections. Western medicine, unfortunately, does not consider this very much or even knows how to address it properly, because most physicians have not been trained in this direction. There is also a synergy between different microparasites. coinfection with Borrelia spirochetes and spirochetes, and Babesia microparasites results in an increased severity of Lyme arthritis and longer duration of the treatment. The transmission vector is the tick or flea or mosquito before the bacteria or microparasites penetrate your body. And in our experience, the medical community tends to downplay the impact and occurrence of co-infections in their patients. Antibacterial natural remedies can help, but comprehensive treatment protocols must be more complex than just a simple nanotherapeutic approach, in our opinion. We have to look at many other factors such as body acidity, the quality of the blood, digestion, quality of respiration. All of these are essential for a sound healing strategy and to improve to improve the quality of life of the patient, to reduce the pain, to improve joint mobility, muscle quality, and treat these infections successfully. And this is exactly what we do at Christine.doctor. So please do not hesitate to contact us. Link in the description box below, and we will help you out. When it comes to a successful therapy, the good news is that individuals with a healthy immune function generally do not have many difficulties clearing out the Babesia. Any natural approach to overcome Babesia should be focused on supporting the restoration of normal immune function and enhancing the healing systems of the body, as well as killing or suppressing the microbes. The list of herbal and natural therapies with value for fighting the Babesia infection is quite extensive, but here are some of them, some herbs that have antiparasitic and antiprotozoal properties to get you moving in the right direction. First on the list, vivid artemisinin. In our opinion, the #1 herbal remedy that can eradicate Babesia, malaria, and all of the other microparasites. As mentioned, Babesia is a microparasite that penetrates the red blood cells, where it resides at the beginning, and after that it spreads into the connective tissue and the stem cells. The primary chemical compound found in Artemisia is artemisinin, which is a proven potent anti-microparasitic that is commonly used for the treatment of malaria and Babesia. Vivid artemisinin, by the way, has also been proven to be a great cancer remedy and also to help with a whole range of other chronic infectious diseases. Contact us for vivid artemisinin and we will help you out on where to get it. Then we have Andrographis. There is a plant that is native to India. It contains antiviral, antibacterial, and antiparasitic properties, and it is widely used in the treatment of Lyme disease and co-infections like Babesia. The herb also enhances immune function and has cardioprotective properties. Suggested dosage is 200 to 800 milligrams. Get a standardized extract to 10 to 30% andrographolites, and you take this to twice or 3 times per day. Next on the list is Alchornea cordifolia. Alchornea is a tropical plant that can be found in both hemispheres. There are at least 60 plant species and 6 of them are found in Africa alone. The most well-known species and one of the most likely to be used for medical purposes is Alchornea cordifolia. It has a variety of therapeutic properties, including being antimalarial, antiprotozoal, and anti-inflammatory, amongst others. Then we have Bidens pilosa. It is the plant that has the most powerful action against malaria and malaria-like microorganisms like Babesia. in addition to its antimalarial properties, it's also antibacterial, anti-inflammatory, and neuroprotective. You should not take this plant, however, if you are diabetic, as it can cause fluctuations in blood glucose and/or insulin levels. Also recommended is cat's claw. It's a plant that is native to the Amazon. It has a long history of traditional use in the treatment of a wide range of inflammatory conditions. It's considered to be a great immunomodulator, meaning it calms an overactive immune system and reduces thereby inflammation. It is also antiprotozoal and therefore can provide coverage against Babesia too. Suggested dosage here 400 to 800 milligrams to 2 to 3 times daily. It is, by the way, especially important to take this herb together with food, as it is activated by the acid in your stomach. If you take acid-blocking drugs, cat's claw will only have very limited value. Next on the list of recommended herbal remedies is cryptolapsis. It is traditionally used to treat malaria in Africa, and it demonstrates systemic antibacterial properties and antiprotozoal properties. It acts anti-inflammatory and provides antimicrobial activity against Babesia. Suggested dosage, you can get it as powder, as tea, or in capsule or tincture form, and the dosage varies depending on the preparation. Then we also have neem, that is a plant that is native to India and also offers potent antibacterial, antiviral, antifungal, anti-inflammatory and antioxidant properties. On top of that, it has a protective effect on your liver and kidneys. The dosage varies depending on the preparation, so follow the recommendations provided by the product provider. Red root, another plant that is great. It is native to North America. It clears the lymphatic system and improves lymphatic drainage. This herb may also help reduce Herxheimer reactions by clearing debris from the dead microbes. It is available as tinctures, tea, and capsules, and again, follow the recommendations provided by the manufacturer on the label when it comes to dosage. Stabilized garlic extract, also known as Alimax, is also great. It has been used in medicine since the beginning of time, more or less, but it is nowadays known that the active chemicals in garlic, called allicin, are very volatile. Through a proprietary process, it is, however, possible to stabilize allicin to increase yield to nearly 100%. And stabilized allicin is now available from several companies. It has been shown to have potent broad-spectrum activity against gram-positive and gram-negative bacteria. It also has antiviral, antifungal, and antiparasitic properties. Suggested dosage 180 to 1200 milligrams of the stabilized allicin up to 3 times per day. And again, the dosage depends on the preparation you use also. Cedar acuta is another great plant. The species of cedar plants different species can be found around the world, and the most well-known one for its medical purposes is the Cedar acuta. This herb has again many good properties, including being antimicrobial, antimalarial, antiprotozoal, and adaptogenic. Other herbs to complement the therapy are milk thistle seed in standardized form, capsules 600 to 1200 milligrams 3 times per day, Camellia sinensis or its epigallocatechin gallate, known as HEGCG, Philanthus neruri, Calophyllum, Tetrapetrum, Curcuma, Santorisa, Licorice, Scutellaria barbata, Cingiber officinalis, Peganum, Euricoma, and Magnolia, as well as Hortuunia tincture, and olive oil infused with olive leaves, 1 ounce in the morning and 1 ounce in the evening. To successfully treat the Babesia infection, we also need to replace the nutrients that have been depleted from our system. And here is a list of supplements that can help you achieve that. B vitamins. I recommend Source Natural coenzymated B complex. Choline, 500 milligrams daily. Zinc, 22 to 50 milligrams daily. Copper. It reduces tissue damage that is caused by the free radicals. It also helps maintain healthy bones and connective tissue, preserves the myelin sheath, keeps your thyroid healthy, and prevents easy rupture of the blood vessels. You should take about 2 to 5 milligrams daily. Selenium, also crucial, 200 micrograms daily. Amino acids are crucial, such as L-arginine, L-tryptophan, L-threonine, L-serine, and other 8 essential amino acids. Riboflavin, also known as vitamin B2, 30 to 40 milligrams 3 times per day. Vitamin E, 200 units or 150 milligrams per day. And acetylcysteine, 2000 milligrams in the morning and 2000 milligrams just before you go to bed. Ashwagandha tincture, half a teaspoon 3 times per day. Careful, it may cause drowsiness. You can get it again in tincture form, dried bulk, or glycerin extract, or in powdered form. The tincture combination of Panax ginseng, licorice root, and schisandra is also recommended, half a teaspoon 3 times per day. Panax ginseng by itself, tincture, again can be obtained bulk dried, glycerin extract, or powdered form. The same goes for licorice root and schisandra. In addition to the antimicrobials, you also must make sure that you support your immune health by focusing on getting good sleep, reducing the intake of refined carbohydrates and processed foods, detoxing yourself to remove the toxins, increasing your exercise level as tolerated by your body to enhance your blood circulation. And you must also stay on course with the treatment, and you'll notice that step by step your health will improve. Co-infections with Borrelia and Babesia show similar impacts and results in both increased severity of Lyme arthritis and a longer duration. Relying on the just kill the pathogens approach is not the most effective way. Thus, we must employ a complex bundle of different herbal remedies and supplements to not just kill the pathogens, but also, as mentioned, replenish the depleted nutrients, lifting the immune system through adequate nutrition, breathing exercises, warm cold showers, also taking care of the traumatic events and psychogenic causes, etc., etc. So we must look at it truly holistically. In a case of the Babesia infection, the most important organs to support are the red blood cells, the spleen, the liver, and the endothelial lining of the blood vessels. And for that we can use Cedar acuta, Salvia miltiorrhiza, or aka Danshen, for spleen and liver inflammations and malfunctions. Red root, especially for the spleen. However, red root is also a great blood coagulant, and you must also add nattokinase and ginkgo to that. Milk thistle seed for your liver. Bidem pilosa together with Panax ginseng. Uva ursi and phellodendron or other berberine tinctures, and also Biden tinctures for your urinary tract and vaginal infections. Bidem pilosa tincture, pleurisy root, licorice root, elecampane root, yerba santa leaves, and lomatium can be used for lung infections. Cedar acuta 6 times per day, NAC 4000 milligrams twice per day, Bidem pilosa 6 times per day for severe anemia or red blood cell lysis. Cedar acuta cryptolysis, alcornia, Bidem pilosa tincture 6 times per day for red blood cells that are infected with mycoplasma. Motherwort, greater celandine tincture, kudzu root tincture for a severe infection of the central nervous system. Chinese Senegal root tincture, lion's mane, 8 grams per day for the neuronal cell destruction. Greater celandine tincture, kudzu root tincture, and theramine for neuropain. Pasque flower tincture, motherwort tincture, and coral root tincture for anxiety. Salvia, miltiorrhiza tincture for spleen inflammation, but also together with pedicularis tincture and Indian pipe as well as theramine for muscle and joint pain. And Eulotherococcus, Sandicosis tincture, rhodiola, schisandra, motherwort, ginkgo, and luteolin for fatigue. We use the following herbs to regulate the immune function, specifically the interleukin 10, TGF-beta, interleukin 12, 18, IFN gamma, TNF-alpha, and nitrous oxide. That, as we have discussed, switches the immune response from the Th2 pathway to the Th1 pathway, namely vivid-artemisinin again, astragalus, schisandra chinensis, salvia, miltiorrhiza, scutellaria, ginkgo, magnolia, pioneer, Angelia sinensis, and to avoid the inhibition of arginase, which is crucial, you can use Panax, Scutellaria, Saururus, Cecropia, and EGCG. With all that being said, I hope that you've gained a better understanding of Babesia, what it can do to you. As you can see, the treatment is quite complex. You can never become 100% immune against this infection, and it might take some time until you completely get rid of it if you're severely infected. You need a custom approach, and for that please contact us at christine.doctor and we will take care of you. Link in the description box below. If you've enjoyed this presentation, please support us directly by becoming a patron from as little as $5 per month. Link is also in the description box below. Do not forget to like, share, subscribe if you're not already, and comment to help this channel grow and spread the truth. And check out some of the most powerful holistic health tools available on the market today at vibrantbody.net. Link, as always, also provided down below. Thank you very much for your attention, and until next time, stay healthy.